Good afternoon, today I'll continue to be talking about the coronavirus, and it's April 14th. So the first news that I'd like to talk about is that in Canada, another testing option has been developed and approved by Health Canada. So this is developed by the company Spartan Bioscience, and the test is something called the Spartan's Cube. It is a very small device that can test coronavirus patients in as less as half an hour, and the federal government as well as provinces of Ontario and Alberta have already agreed to buy millions of dollars worth of testing devices and kits, around 900,000 from 100,000 to 900,000. So there's an urgent need for rapid COVID-19 testing, and as a Canadian company, we're excited that our technology will be important in fighting the COVID-19 pandemic in Canada, according to Spartan CEO Paul Lem. So this is something that involves inserting a cartridge containing a swab from a patient's mouth into a machine about the size of a coffee cup, which is the cube, and that analyzes DNA for the presence of coronavirus. So basically DNA testing. And this can be deployed anywhere from doctors' offices, pharmacies, community centers to airports, cruise ships, and border crossings, because there is no need, a non-professional can handle the testing, and so as a result it can be sent almost everywhere, which would be extremely convenient, and as it's quite small, it could help combat the testing shortage, whereas now the testing results have to be sent to a lab, and then it has to come back, which will take days, and just it could save a lot of time in testing more people. This would also take millions of dollars in additional capital to manufacture more thousands and millions of testing cartridges, but Paul Lem says that he's closely raising a significant amount of funding from private investors. So this is just another option of testing that is being used, available in Canada, and maybe all over the world we could happen. So the second thing I'd like to talk about today is that New Jersey has announced its most deadliest day yet, and another 365 people had died of the virus, and now in the state there is a recorded 2,805 virus-related deaths. There's even more cases, but despite these jump in fatalities, which is almost 4 times as many deaths were reported on Tuesday as on Monday, the governor, Mr. Murphy, said that the virus spread still appeared to be slowing. So the number of virus patients on ventilators have been nearly flat for the past 4 days, and is now 3% below the peak it reached last Friday. So he says that the curve is beginning, and I repeat, beginning to flatten, according to Mr. Murphy. This is obviously really good news, as if New York is beginning to flatten, and then New Jersey follows, then it could mean that all over the United States we might see the same thing happening, where the virus has finally begun to decline in fatalities rate and virus infection rates. So these are good. This is a very exciting thing to see, as so maybe the virus is finally deadly and dangerous spread in the United States, maybe declining, and which is quite wonderful, as maybe life will return to normal in a few weeks, possibly months, as more governors begin to talk about reopening the economy, and here in California, Governor Newsom has also been talking about reopening the country. The third thing I'd like to talk about is that previously nursing homes in the US were extremely damaged, but fears of rising for residents of nursing homes in Britain have also risen. So more than 2,000 facilities in Britain have reported cases of the coronavirus, and these fatal deaths have gone uncounted in care homes, as there were not included in the official daily coronavirus toll. This is quite dangerous, as the public wouldn't know what is the real number of deaths, and so the government has been receiving criticism, but it says that it will shorten the lag quickly. Care workers in nursing homes and hospices have also raised the alarm over severe shortage of personal protective equipment, and he says that supplies are being diverted to hospitals instead of the nursing homes, where again it's just not so different from a hospital, as there is bad conditions, there's shortage of testing equipment, and I think that supplies should be evenly distributed to nursing homes and hospitals alike. I think it just should be distributed as to where is the most cases occurring, and don't leave the nursing homes just out of equipment, and then again with nursing homes full of older population, often with the underlying condition that are just absolutely fatal from this disease. That's it. Thank you for listening, and I hope you have a good day.